Thank you for the introduction and the opportunity to discuss our work with the SARS-CoV-2 virus and white-tailed deer. All of the work I'm going to present today has been a collaboration between researchers at the USDA's National Animal Disease Center in Ames, Iowa, and Dr. Diego Diel and colleagues at the Animal Health Diagnostic Center at Cornell University College of Veterinary Medicine in Ithaca, New York. An analysis of 335 emerging disease events occurring between 1940 and 2004 showed that more than 60% were zoonotic, and over 70% of those had an epidemiologically important wildlife host. One of the worst case scenarios would be an emerging zoonotic disease agent of livestock, poultry, or wildlife that jumps from its animal host to humans and achieves efficient human-to-human transmission, that is, achieves pandemic potential, causing high rates of mortality, resulting in devastating impact on public health and possibly livestock, poultry, or wildlife. We are today in the midst of one of the most devastating pandemics in this century, caused by a zoonotic agent that has been transmitted from an unknown wildlife species to humans. Therefore, it is critical to understand which animals are susceptible to infection with SARS-CoV-2 and which animals are capable of transmitting the disease to humans or other animals. Others, including us at the National Animal Disease Center, have examined the susceptibility of poultry, cattle, and pigs. Thus far, studies have demonstrated no susceptibility or limited susceptibility. But why did we go on to look at white-tailed deer? First, understand that the SARS-CoV-2 virus uses as a receptor on cells a protein known as ACE2. Once the virus binds to the ACE2 receptor, it is internalized and the cell is then infected. Last year, in a paper by DeMoss in the Proceedings of the National Academy of Sciences, they examined the ACE2 receptor binding region of various animal species, comparing them to the human and predicting the potential for binding with the SARS-CoV-2 spike protein. They then categorized the binding potential for each species from very high to very low. Not surprising, many species of non-human primates fell in the very high probability grouping. Somewhat surprising, however, 3 species of deer, white-tailed deer, reindeer, and paired David's deer, fell in the high probability grouping. Given all these considerations, we chose to evaluate the susceptibility of white-tailed deer to experimental infection with SARS-CoV-2. We had 6 2-month-old fawns remaining from our breeding herd to use in this study. Using an isolate that our Cornell collaborators had isolated from a tiger in the Bronx Zoo and then had traced that back to the tiger's caretaker, we intranasally inoculated 4 fawns, using the remaining 2 fawns as non-inoculated contact sentinels. Baseline temperatures and pre-inoculation samples were obtained. After inoculation, body temperatures were evaluated daily using subcutaneous chips and a chip reader. Nasal and rectal swabs were collected for PCR to detect viral RNA and virus isolation to detect replicating virus. This was done daily for the first 7 days and then on days 10, 12, 14, and 21. Blood was collected for virus isolation and serology for antibodies to SARS-CoV-2 on days 0, 7, 14, and 21. PCR, virus isolation, and serology were performed by our collaborators at Cornell. It is worth describing the room in our biosafety level 3 facility in which the fawns were kept. The room was approximately 12 feet by 12 feet, with a barrier approximately 4 feet high dividing the room in half to prevent nose-to-nose contact between inoculated and sentinel deer. Airflow inside these rooms is kept at 10 to 11 changes per hour, and the direction of the airflow moved in a manner that was primarily from contact fawns towards inoculated fawns. During the 21-day study period, no fever was detected, and there was no change in behavior or appetite. If we look at PCR results of nasal swabs, Now, PCR results are detecting RNA, viral RNA, and not necessarily replicating virus. These first four graphs are inoculated fawns, and we can see that in their nasal secretions, they shed viral RNA, most of them for the 21-day period of the study. We also note, however, in the contact sentinel fawns, these bottom two graphs, that they began shedding viral RNA by day 2. These bars represent viral RNA from rectal swabs, and we can see that all fawns, inoculated and contact fawns, shed viral RNA intermittently in their feces. If we look at virus isolation results now on the right, which look at infectious replicating virus, not just the RNA, we see that virus was shed for about a 5 to 7 day period. And in contrast, viral RNA was found on rectal swabs only on day 1, 24 hours after inoculation, probably the result of pass-through from swallowing some inoculum. And this probably suggests that the GI tract is not a site of replication for this virus. Following postmortem examination on day 21, it was revealed that multiple tissues from all fawns were PCR positive, contained viral RNA, but virus isolation negative, meaning there was no replicating virus present. In all of the fawns, the palatine, tonsil, and medial retropharyngeal lymph nodes were PCR positive. Other tissues commonly positive were other lymph nodes of the head, such as the submandibular lymph node and the nasal turbinates. Other random scattered tissues were also positive by PCR. However, note that the lung was negative for viral RNA. Also important, all fawns developed high levels of virus-neutralizing antibody by day 7. And we can see that antibody titers in inoculated fawns in blue were generally higher than those seen in the contact fawns in red and brown, which could very well be a dose effect, and that the dose that the contact fawns were exposed to was likely somewhat less than the dose given to inoculated fawns. Our conclusions from this study are that unlike other ruminants, such as cattle, white-tailed deer are susceptible to experimental infection with SARS-CoV-2, but infection and viral replication do not result in clinical signs. SARS-CoV-2 replicates and can be shed in nasal secretions for at least 7 days after infection. Fecal shedding and replicating virus appears to be minimal. Infected deer develop virus-neutralizing antibodies by day 7. Viral shedding is of significant magnitude to transmit virus to other deer. Some other conclusions that we noted. We did not find virus in the blood, so viremia does not seem to be a feature of this experimental infection model. And viral RNA can persist in lymphoid tissues for at least 21 days, although replicating virus is cleared much earlier. So the question comes up, how did the contacts become infected? We're confident that there was no nose-to-nose contact. However, virus could have gone over or under the barrier in water or water droplets as the pens were cleaned. It's also possible that true aerosol transmission occurred with virus-laden droplets that can remain suspended in the air and carried over long distances. So that summarized our first study in white-tailed deer, and a preprint of that paper is available on bioRxiv online, and it's been submitted to a scientific peer-reviewed journal. We just completed our second deer study, and this is the first time I've presented this data as it's just coming in, and so I don't have all of the results yet. In our second study, we wanted to confirm our findings in study number 1, that being that deer are indeed susceptible to infection, but we wanted to better establish the shedding patterns. We wanted to better control possible routes of transmission and eliminate some of the unknowns of the first study. So there were a couple of differences in this study. First of all, we used deer that were approximately 8 to 9 months old. These deer were inoculated with an isolate similar to the most prevalent human isolate circulating in the U.S. rather than the Tyget isolate. So similar to before, no fevers were recorded during the 21-day period of the study, but some deer did have mild mucus discharge from the nose. One deer was noted coughing several times, and there was one deer that for several days in a row, after handling, would move to a corner and lie down for several minutes. None of these signs were severe, and all were categorized as mild. It might be helpful if I explain how we examined deer-to-deer transmission in study number 2. First of all personnel wore personal protective equipment to prevent not only zoonotic transmission from deer to us, but also reverse zoonotic transmission, potential transmission from us back to the deer. This given their apparent high susceptibility to infection with SARS-CoV-2. In study number 2, we had 3 negative control deer that were never infected, that remained in a single room the whole time. Dedicated staff cared for, fed, and collected samples from the negative controls. These staff members never did anything with infected deer. 6 deer were intranasally inoculated on day 0. On day 3, 2 clean deer were moved to a clean room. The inoculated deer were then introduced, and these deer commingled for 48 hours. The 2 contact deer were bled and oral nasal swabs collected on entering the room and leaving the room 48 hours later. These 2 contact deer were moved out and kept together in their own clean room. When the inoculated deer left their room on day 3, it was decontaminated twice, the feed was discarded, and let sit for the 48-hour period. On day 6, 2 clean deer were moved into that clean room with clean feed, and the inoculated deer were moved back and introduced, and these deer commingled for 48 hours. Later, the 2 contact deer were moved back to their clean room. We took these precautions because we wanted to be sure that contact deer were becoming infected from the infected deer and not from contaminated surroundings where the inoculated deer had been housed or the contaminated feed the inoculated deer had been eating. So here are the results so far, and we only have PCR results. We don't have any data on virus isolation and infectious virus. Similar to study number 1, most inoculated deer shed viral RNA in their nasal secretions for the duration of the study. The other lines that you see here paralleling the nasal secretions are the saliva. So viral RNA was shed in both saliva and nasal secretions in a similar pattern. We also see, similar to study number 1, intermittent shedding of a low amount of viral RNA in the feces. The 2 contact deer that began commingling with inoculated deer on day 3 had viral RNA in their oral nasal secretions on day 5 when they were removed. No viral RNA was detected in deer commingling from day 6 to 8. And 1 fawn that commingled on days 9 to 11 had a low amount of viral RNA in its oral nasal secretions. The other was negative. At postmortem examination on day 21, 3 of 6 inoculated fawns and 1 contact fawn from each period had very mild lesions limited to the right cranial lung lobe. These deer also had variable amounts of mucoid discharge in the trachea and the bronchi. So similar to study number 1, we found that deer were susceptible to infection, this time with a different isolate. Deer shed viral RNA in their nasal secretions and feces. Deer transmitted viral RNA to non-infected deer. Things we saw in study number 2 that we did not see in study number 1 were mild clinical signs, again not enough to alter their appetite. We saw mild gross lesions this time, and we detected viral RNA in saliva, which was a sample that we didn't collect in study number 1. We're still waiting on virus isolation results, serology, and histopathology from this second study. In the future, we would like to look at mature deer to see if there is any age-related difference in susceptibility. We would like to conduct time course studies to characterize the pathogenesis. We would like to conduct dose titration studies to determine the minimum infectious dose and determine if after infection deer can become reinfected, or does infection confer immunity. Thank you for the opportunity to share these results, and I'll be happy to take any questions.